All right, so really fast, as quickly as possible, but not like 60 seconds. I'm going to give you the formula to selling home health care. And if you can't sell home health care after this, I want you to give up. Go work in a factory. Go work in fucking McDonald's, because you don't deserve to be a Medicare agent anymore. All right, here we go. So the first thing you're going to do, step one is to educate on the difference between home health care and home health aid. So we go something like this. Miss Jones, great to hear from you. Hope you're doing well. Build some rapport, whatever. Woo, woo. By the way, Miss Jones, do you know the difference between home health care and home health aid? Of course you don't. Nobody does, except me. Home health care, Miss Jones, is medical in nature, and it's covered by Medicare up to 35 hours a week. 35 hours will typically cover you for everything that you need to have covered at home medically, but most people they're not happy with having that limit. So how do we maximize that and get you more? That's number one. But another thing is home health aid is not covered by Medicare. So what that's going to be is your custodial things, your daily living things, right? Right now you have the ability to wash your dishes and clean your kitchen and cook food for yourself and your family, and you have the ability to wipe your own ass, and you have the ability to dress yourself, move from the bed to the living room. You have these abilities, but in certain situations like cancer, heart attack, stroke, all these different issues that you could break your hip, you could have a knee replacement, whatever. You don't have that ability. So it's not covered by Medicare. So what do you do? Right? I'll get to that in a second. All right. So what we do is we cover that up. The way that we cover that up is we actually get you a cash benefit. We want you to make money in that situation so that you can use that excess of money to pay people to come and do those things for you. There's home health agencies out there that'll come in. They'll even give you like what's called, they give you this service where they're there for you. It's like a therapist. They'll come to your house and they'll help you cope with the fact that your life has changed, right? You can't get up and move hardly. Like there's some people get depressed, right? I'm not saying that that's, everybody, but it's there. You can use this money for anything. Home health agencies will come in and help you with the day-to-day living things that you're not going to be able to cover anymore. So that's what we want to use it for. But another thing is you can use that money for whatever you want. Keep that in mind. Now, let's say you have a daughter, you have a loved one, something like that. Those people, we don't want to rely on them to wipe our rear end. Who wants your wife to wipe your ass? Nobody wants that. So we need to have this program in place. That way we have something there financially to pay someone to come in, and then let your wife, let your daughter, let your children, your loved ones, whoever, let them monitor and oversee these situations. That way you know that you're being taken care of properly, okay? So how do we pay for this? Well, the good news is there is a cash back benefit in this program through the state of X that basically Heartland National or Baker's Fidelity or whoever, Heartland National partnered with the state of X to give you this program. And this program is going to pay you a daily benefit of up to $700 a day or whatever it is. That daily benefit you're going to be able to use for anything, any of the things that I just mentioned. The bottom line is you don't have the coverage right now. Let's get you the coverage. But the cool thing is, how many medications do you take? Oh, you take 10 medications. Wow. So those 10 medications, they're going to give you $15 for each generic one and $30 for each name brand. I'm looking here, and your birthday is 5/1/1956, correct? Okay, great. Let me tell you this. With those 10 medications that you take, this program is going to be no cost to you. Every 12 months, you're going to get a $720 check in the mail. The total premium is $696. It's a no-brainer. It's a slam dunk. I know what you're thinking. It's too good to be true. I've heard it so many times. So real quick, I'm going to send you a quick brochure in the... Can you stop real quick? in an email, I'm going to send you a quick brochure so that you can go over it real quick, okay? And then go over the brochure with them, and then they'll be able to see right there in front of their face exactly what you're talking about. And then you sign them up. If you can't sell home health care after this 5-minute video, you suck at selling. Just continue to do your little 0 premium Medicare Advantage plans and allow your your clients to suffer. And when I talk to them, or one of my agents talks to them, they're going to steal them from you because you didn't give them all the information that they need.
I could not